and welcome back to my YouTube channel. I'm Dr. Heather Hirsch, and today we're going to talk about bleeding shortly after starting hormone replacement therapy. We're going to talk about why this happens, what you can do about it, and what does this mean going forward. Bleeding after starting hormone replacement therapy can be totally a bummer because you're so excited, but now perhaps you or your doctor is worried or you're just inconvenienced by it. So let's uncover what's actually going on. If you're interested to learn more, then stick around. Hi, if you don't know me, I am Dr. Heather Hirsch. I am a board certified internist, nationally known menopause expert, author of the book Unlock Your Menopause Type, and importantly, physician. And I have a private telemedicine practice where I see patients virtually. Links for all of that fun stuff is in the description below. And of course, I spend a lot of time doing videos here over on YouTube because as women, we simply are not taught enough about our bodies, particularly in midlife and at menopause. Now, if you're like many of my patients or a lot of folks who watch my videos, you're interested in hormone replacement therapy. I did a great video on how to get started thinking about hormone replacement therapy. I'll link that here, and it's a great video to watch. Now, most women are always worried if they have bleeding shortly after starting hormone replacement therapy. In fact, for my patients, even though a lot of women are worried about the scary things like a blood clot or cancers, which actually I have plenty of videos on demonstrating how safe hormone replacement therapy is, the most common thing to happen after starting is one of these annoying side effects like breast tenderness and bleeding. Bleeding is not going to happen if you don't have a uterus. So if you've had a hysterectomy, it's unlikely that you're going to have bleeding, although vaginal bleeding is not unheard of. So the big question here is, what is causing the bleeding? In all actuality, it's probably the hormones that are causing the bleeding. And that sounds obvious, but when you think about what we're doing with estrogen replacement and then progesterone if you have your uterus, is we're trying to use estrogen to calm those receptors in the brain that are looking for estrogen, help your bones stay healthy, help the pelvic floor stay healthy, treat any vaginal dryness, which is genitourinary syndrome of menopause, and then keep the uterus out of it. But we can't exactly tell the estrogen exactly where to go and exactly not where to go. So the uterus is just like any other organ, and it's going to absorb some of that estrogen. And it's going to do exactly what it knows how to do, which is build up its lining because of that hormone. And then once it reaches a critical mass, what goes up must come down eventually. And so there can be bleeding. So one of the things that can actually make this maybe worse or more likely is if you have a polyp or a fibroid. Now, a fibroid, what that really is increasing the total surface area of the uterine lining, which just means there's more receptors and there's more tissue that could get involved on the fun here. And so a polyp or a fibroid can increase the propensity or the amount of bleeding that you might have if you're starting on HRT. And this is simply hormonal. It's actually nothing too worrisome. The other organ that can get involved is actually the ovaries, and you could actually ovulate. Now, even if it's been many years since menopause, this is not totally impossible. It's almost like the ovaries sense that there is a good environment out there and they're like, let's give it one more hurrah. Now, my patients almost inevitably ask me, oh my gosh, does that mean I could get pregnant? Now, the chances are not exactly zero because hormone replacement therapy is not, I repeat, is not birth control, but typically that egg quality is fairly low and likely not to result in a pregnancy. But be sure that you are talking about this with your doctor. Now, the reason most doctors are worried is they don't want to miss uterine cancer. And uterine cancer usually presents as post-menopausal bleeding. But if you are just starting on HRT or you are just adjusting your dose, your route, or the formula, 6-month window is a normal time frame for hormonal bleeding because of the hormones that we are giving you. And this is really different from someone who's not on HRT and having postmenopausal bleeding, or maybe who's been on hormone replacement therapy for, let's say, 2-3 years and then starts to have bleeding. It does not mean that it is cancer. In fact, that's actually the least likely, but it is of course the thing that we want to rule out. So this is a reason why you may end up getting an ultrasound. Now, I'm going to put ultrasounds on the back burner because what I want to focus on is if you're having bleeding in the first 6 months of starting on HRT, because it is an acceptable side effect, what can be done? The first thing that can be done is you could try to reduce your estrogen dose. In fact, I always tell my patients that if we're having a lot of breast tenderness or bleeding, it's probably a sign that your dose is too high, especially if it's right after you start or even a few weeks after. It means that the dose is simply too high. So you want to reduce the estrogen dose, whether you're taking it orally, a patch, a gel, reduce the dose. The other thing that could be done is to increase the progesterone dose. And sometimes actually I do both. I decrease the estrogen and I increase the progesterone. This is a little individualized, and that's where that one-on-one consulting is really important. But you absolutely can also try to increase the progesterone, and here's why. Progesterone almost acts like the glue that holds the uterine lining together. And sometimes you have not enough progesterone to match the estrogen. This is a huge reason that I do not recommend compounding your hormone replacement therapy, because there's no good way to make sure that you're getting the right progesterone to match the dose of estrogen that you're on. So adjusting your hormones is something you can absolutely do. And thirdly, you could always consider placing a progesterone releasing IUD. And in fact, I have a great video here on that. And the reason you could consider that is if bleeding is absolutely an unwanted side effect that you simply do not want, or as you're thinking about continuing on hormone therapy and you don't have to worry about bleeding, or your doctor is very anxious about this, you absolutely could consider placing a progesterone releasing IUD. In fact, it's a reason that I place IUDs in a lot of my women who are already past the birth control age, because even when we do adjust the dose, they still continue to have either spotting or bleeding. And a Mirena is really the most likely to completely take this bleeding out of the equation. Most doctors next are going to want to do an ultrasound. Again, I think that if it's within the first 6 months, it's probably not necessary and you should adjust the doses first. But an ultrasound is typically going to be the next recommendation. And what we're looking for is anatomical reasons for bleeding, so the fibroid or the polyps, but we also want to check the uterine lining. And typically your doctor might recommend a biopsy if that uterine lining is greater than 5 millimeters. And that's again because the clinician wants to absolutely rule out the possibility of uterine cancer. Now, I want to tell y'all that in as long as I've been doing HRT and if all the research that I have seen, as long as the estrogen dose is correctly paired with the progesterone dose, this risk is absolutely mitigated. So just to summarize, bleeding within the first 6 months after starting hormone replacement therapy is very, very common. And the first thing that can be done is to alter your doses. Lower your estrogen, increase your progesterone, and if the problem is persistent or this is an absolute deal breaker for you, consider placing an IUD. And this is not just when you're starting, but anytime you're changing the dose, the route, or the formulation. Reasons for bleeding are most likely hormonal, and they can be worsened if you have a fibroid or a polyp. And also sometimes the ovaries can actually get involved and you may even ovulate a time or two. If the bleeding does persist, your doctor might want to order an ultrasound and see if you need either an endometrial biopsy or actually something called a dilation curettage, a DNC, which is more of an absolute medical management for the bleeding. I hope this gives you a lot of confidence in that the fact that bleeding after starting HRT is still really normal. It's absolutely within the realm of the body's possibilities and nothing that you need to worry about, but something that we want to help stop so that you can live your best life, thrive and function without worrying while you're on your HRT. I hope you guys enjoyed this video. Please consider subscribing. It's free to do so. You can always unsubscribe if you change your mind. Thank you so much for watching my videos. Drop me a comment down below. Did this happen to you? And did this video help? And definitely check out my new book, Unlock Your Menopause Type. I hope you love it. I wrote it with so many of you in mind. Have a wonderful week and I'll see you next time for a brand new video. Bye everyone.